Hello, and welcome to another day of Living with Spina Bifida. Today I thought I would talk to you about doctors. Doctors and their lack of treatments. Doctors and their ignorance. Doctors and their stubbornness. Doctors and their arrogance. Doctors that are not properly educated in various areas of medical issues. There are doctors out there that still can't even pronounce spina bifida properly. And don't even get me started on Chiari malformation. There's just a lot of misinformation going around in the medical field. And a lot of people aren't even learning new things. They are stuck in the old days, in the old knowledge. So if they're being treated at all, a lot of medical problems and medical conditions are still being treated like they would back in the old days. So patients are getting ignored. Patients are being treated for the wrong issues, if they're being treated at all for these issues. And they are treated like crap, basically. If you even slightly act or suggest like you know more than they do about a certain area of medical, they will likely give you an attitude or just blow you off altogether. I know this is what is happening to me personally. I am being treated for everything medically at the Mayo Clinic in Minnesota. And if you are in the spina bifida community, if you are in the Chiari malformation community, better to put it, most people will tell you stay away from the Mayo Clinic. They know next to nothing about Chiari malformation. And that is my biggest issue right now, is I'm not being treated properly for my Chiari. My doctor is under the impression that the shunt in my head that drains the fluid from my hydrocephalus has essentially cured my Chiari. So all of the issues that I am having medically could not possibly be from Chiari because I have a shunt. So I'm okay. So anytime I even utter the words Chiari, I get blown off. I get treated like I'm a nuisance. And they don't like being told that they're doing their job wrong. They don't like when patients know more about their own problems than the doctors do, because they think because they went to medical school that they should know everything. But in reality, they're not the ones that live with this. They've never had it. They've never experienced it. They can go home and not have something wrong with them. They can go home and not have a chronic medical condition. So it's not that big of a deal to them. I guess I can't really blame doctors for not being properly educated when it comes to certain disabilities, birth defects, ailments, issues. But when they completely blow you off and they just won't listen to you that there is a problem, then that is a problem. Because when you're having issue after issue after issue, you would think they would want something to give. I know I do. I know I certainly don't like the new me that has become. I certainly don't like what my body is forcing me to live like these last couple of years. So I would kind of like to get things figured out. I would like doctors to get their heads out of their asses and get something done. So like I said, it is a constant struggle, and I messaged my doctor today about new symptoms that I am having within the last couple of weeks, which are pointing towards me having Ehlers-Danlos syndrome, or EDS, and also postural orthostatic tachycardia syndrome, or POTS. And I messaged my doctor saying I would like to get the proper testing so I can be properly diagnosed with these two new syndromes, because more often than not, they both go hand in hand with Chiari malformation and having spina bifida, hydrocephalus, Chiari. It's more than likely that I have these other two syndromes. So I am waiting to see what she has to say about my latest message, and depending on what she has to say, I may or may not be finding a new doctor. I know it's really difficult to find a proper Chiari doctor in the whole country. There's not very many specialists in the entire country. And I know you would think that Mayo Clinic would have one or two specialists because they're the gods of the medical fields, but no, they are pretty much anti-Chiari. And like I said, stay away if you have Chiari, because they're more than likely not gonna treat you properly. I'm waiting to hear back from them, and then I just have to most likely muster up the courage to shop around for a new doctor, because I am now going to list off, literally, I have a list written down of all my issues, all my ailments, all my problems, everything going on with my body. And I more than likely missed something that just pops up sometimes, and it's not constantly there, so I don't think about it as often. These are just off the top of my head written down problems. So obviously I have spina bifida, I have hydrocephalus, I have Chiari malformation, which in fact I found out about a year ago that I was born with it, and I've had it the whole time. It's just never been brought up to me, even when I started showing symptoms of Chiari, and they still won't do the decompression surgery because I'm basically not dying on the floor in front of them, so they don't want to do anything about it. So I just get to sit here with all of these problems when it could be fixed with surgery. I myself am not really afraid of surgery. If it needs done, I'll get it done, and that's that. Yes, there's risks. Yes, problems could occur. Yes, I could end up worse than I am now, but I don't know until I try. And that's just how I am different from a lot of people, and obviously a lot of doctors. I want to do it, but nobody wants to do it for me. And like I said before, with the Chiari, the doctor I have now thinks that the shunt for my hydrocephalus is basically curing my Chiari. So there should be no worries since my shunt is working properly. So they don't want to do anything else about it. And I recently found out that I have tethered cord, which is very common with spina bifida. But they also told me that my spine is too complicated for them to want to do the tethered cord release surgery. So I'm too complicated to fix. So I get to just deal with those pains and problems from that too. They're not going to do anything about that either. And I recently have been showing signs of having EDS and POTS, which neither one I have been tested for. There are tests for them. So symptoms. I have a constant stabbing headache. It's always right over my shunt, and it's just always there. There's constantly an ice pick in my head. Once in a while, usually when the weather changes, I will have a regular headache. There, it's my barometer. I have almost constant tinnitus ringing in my ears, and I get quite dizzy and lightheaded. I start seeing spots and all that fun stuff quite often as well. Frequent nausea, especially after I eat, but sometimes it just comes out of nowhere. It's constantly feeling bleh. Constant fatigue, constant exhaustion. I take naps. I try to daily, and even if I get enough sleep, I still wake up like I didn't sleep. Beyond exhausting. It gets really difficult to push through days, but I manage. And my doctor also told me, basically since I am not fat, they will not test me for sleep apnea, which is very common with Chiari malformation. So I could essentially die in my sleep because no one wants to do anything about it because I'm not some fatly, when obviously there are many people that have some form of sleep apnea and they are quite small. Constipation or diarrhea, never any in between. And since I have pelvic floor dysfunction, it's just almost impossible for me to go to the bathroom. So then I have bloating, cramping, pains all day long. I get random body twitches. I don't know why, but just every once in a while I'll just be sitting there and then I'll go blah, and didn't have a shiver, didn't have a warning, didn't have nothing. It just, that's happening now. I was finally diagnosed with tachycardia, and I am on medication for that, and that took me several years to figure out what was going on. And it's one of those, we don't know why it's happening, but I have Chiari, so that's why it's happening. My brain is coming out of the back of my skull. Don't you think that would affect some things in my body? No, I have a shunt. It's carrying my Chiari. Let's not worry. Breathing issues. I've been tested for asthma and all that. I've had my nose checked out and they can't come up with anything. So they are chalking it down to anxiety, which I do have, along with depression and borderline personality disorder. And I have hallucinations randomly throughout my day. And I also have really terrible nightmares just about every single night. And like I said, the tethered cord. And newly, I am starting to have what I am referring to as contractions in my tailbone, which make my lower half basically scrunch up, and it feels like restless leg syndrome in a way, and where my lower body just needs to move. And a lot of times, which I feel is counterproductive, but a lot of times when my body is contracting like that, my lower half won't work. I can't walk. I can't put any weight on my legs, but I'm too complicated to fix. Shoulders, lower back, hip, tailbone, pain, 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 pain. I got a back brace. I got new things in my wheelchair. Still the pain. Now what? My legs have recently started to turn purple whenever I basically bear any weight on them. And lastly, I have had for the last 3 weeks now a head to toe really terrible rash. It more than likely came about from our laundry soap because I am allergic to dyes and perfumes. But still, since sometimes the rash improves, my doctor is chalking it up to a virus, and they will not give me an allergy test, even though I have asked several times. And even though the doctor I did see, which is not my regular doctor, but she was a fill-in for my doctor who was on vacation, told me after a week of taking Benadryl, even if the rash was gone, they were going to give me an allergy test. And now I am hearing I am not going to get an allergy test because it gets better some days. So it's a virus. So that's what I deal with on a regular daily basis. And some of the symptoms have been tamed. They're not gone, but some of the symptoms have been helped with tons of medication that I am on. And like I have said, a lot of these things are sticking with me because of basically doctor negligence. They don't want to listen to the patient. They're the doctor. They went to medical school, so they know what's best, even though they don't realize that there is more to learn than what they did learn in medical school. New knowledge comes out all of the time. Things are changing. People are finding new things. And if you stick to a textbook from the 50s, 60s, 70s, you are obviously learning from really old information and sometimes wrong information, because a lot of times we find out that how we were treating something was wrong, and then we found out the right way to treat it and it got better. But we are still in a fight to get people to know about spina bifida, especially in adult. They don't really have adult spina bifida clinics. You only really see children's spina bifida clinics. So, like I said before, doctors sometimes can't even pronounce spina bifida, let alone help you with it. And Chiari, most doctors can't pronounce that either. And most doctors don't even know what it is. Some of them don't even know it's a thing. And other doctors, like mine, think that something that treats something completely different that is unrelated is curing my Chiari. And a lot of doctors think that because you get the decompression surgery, that you are then cured too, which is not the case. You are just helping relieve a lot of your symptoms. They're not going to go away. They're not going to be fixed. And sometimes you have to have the surgery more than once. So we are still in the fight to get properly treated like people in the medical community. We need doctors who will listen to us. We need doctors who will care about us. And we need doctors who aren't so arrogant and stubborn, because really, truthfully, honestly, what they're doing is killing us. If we aren't treated properly, we could die. So I ask you, share this video with as many people as you can. Not for my sake, but for everyone's sake that is having issues with doctors. Share it with doctors. Share it with as many people as you can. Get this out there that we are not being treated like we need to be treated. We need help.